For my video summary of Monday, April 16th, it was a very, very dead day at the clinic. 3 doctors were off for the day and only 2 doctors were on in hospital. Dr. Copeland was out on ranch calls for the day, and she already had her assistant assigned for the day. So I was kind of a floater around the hospital, and while I was there, only got to see one patient that came in for a laceration. I will post pictures of that because it was very, very gnarly. Dr. Sakai was the doctor in hospital, and so he evaluated the laceration, and the owners reported that the laceration happened about a day and a half or so prior to bringing him in, but Dr. Sakai said by the way the tissue was trying to heal, he thinks it happened sooner, and from the story that they gave us, it just didn't make sense that it happened a day and a half ago, so he was suspected of it happened probably on Friday. This was a 1-year-old colt, and he was at the trainer's house, and the stall boy noticed the laceration, so these people went and picked him up that actually bred him, and so they went and picked him up and brought him in, and his entire knee was just filleted open. Bone was showing, ligaments were severed and everything like that, so Dr. Sakai sedated him, evaluated it more, and said it wasn't looking good. He thought everything was going into the joint, and even surgery he doesn't think would have done anything. They could have done surgery, but this colt would probably not have made anything growing up. He probably would have just been a yard ornament, unfortunately, and just lived his life out by hanging out, maybe doing trail rides, but definitely would not be able to do what he was bred for, which is reining cow horse. So that was unfortunate. So we did offer to take x-rays and everything to just kind of evaluate to see what damage was done, but the owners were like, no, we're not going to spend all this money and then end up having to put him down. Let's just put him down, take him out of his misery, because he was in quite a bit of pain. So we did that. I held for the entire procedure, and then we brought him out to, they have a spot behind one of the barns where they euthanize the horses, and then they cover them with a tarp to kind of keep them out of sight, out of mind from any other clients that may or may not be passing through. And it was a pretty bad euthanasia from what they were telling me. They started the injection, and right as they finished it up, he flailed and flew backwards, and then he was out. So that was that. And then for today, I was assigned with Dr. Lau, and we were out on ranch calls all day, and she had a vaccine and float clinic going on. So I think we did about 12 EWT, West Nile, and flu rhino vaccines. We also did about 5 CD&T vaccines. With the vaccines, there was also another assistant with us today, Brittany, and her and I switched off holding the horses for Dr. Lau. And then with the CD&T, we held a alpaca, and we also trimmed his feet, and so I got to restrain him and learn how to restrain him properly. So basically, if they will let you, since alpacas are a little bit smaller, the trick is to just let them rest their head on you and try to stay as close to them as possible, and basically just cuddle them and give them a hug, and hopefully they don't go anywhere. But when they feel scared, they will cush, which means they'll lay down. So he did do that, but he was a very good boy for us. We just pulled his leg out, and Dr. Lau trimmed up his hooves. And then we did the CD&T, and then we do give that in the right armpit. There really is no difference or rhyme or reason behind it. Dr. Lau just likes to do that because the CD&T vaccine is known to cause a lump or an abscess. So if owners do notice a lump or an abscess coming up in that area, and we look on records and they had gotten a CD&T vaccine recently, then we kind of know that it could be that. Then we can call the vaccine company and they can handle that situation, because they have the liability where if something goes wrong, that they will cover the vet charges to kind of diagnostic wise to get everything treated and everything for those lumps. We did the same thing for a sheep. And then we did health certs on them as well because they were headed to Oregon. They were both really good kiddos, and then sheep, you basically just kind of like hold on for dear life because they are fight or flight or they are flight prey animals. So if they get captured, they are trying to run you over or run away. But he was actually a pretty good kiddo. I guess he was a bottle baby, so he was pretty tolerant for us. Same thing with the CD&T for him. It goes under the right armpit in the axillary area. And then to top off our day or end our day, we did 2 floats on 2 mares. They were really, really good for us. I helped restrain for both of them, so we had the horse's head up on the headstand, and I just held on to them, making sure that they were standing up for Dr. Lau and not fighting too much and kind of keeping their heads stable while she drilled away. Also today I did get to, we also dewormed quite a few of our kiddos today. So I dewormed some goats with, now I'm gonna lose my train of thought here. Spiramectin. I didn't get to write anything down because we had quite the full day, so I'm hoping that that's close to it, or you kind of know what I'm talking about. So I did get to deworm some goats and then deworm some horses with the Stronzid, and it smells like apples, but I guess the horses don't really like it. It's very bitter tasting, I guess, and it's a paste. And Dr. Lau said that she switches back and forth between the Stronzid and Pyrantel and a couple other things, just so the body doesn't become immune to it, or the little critters that may or may not be floating around don't get immune to it either. And then I also got to do some IV injections today, which was exciting. I got to do the sedation. Dr. Lau likes to use Dorm or Detomidine for her sedation for her floats. So we pulled that up, and I got to administer that on both the horses today, which was nice. Got my practice in. And I'm happy to say that I'm getting those veins on the first tries. Don't have to mess around with it too much. Even though those veins are big, they can be tricky sometimes. So that was really fun, and then that's what we ended our day with, and then came back. And I started to help with a mare who had her foal on Sunday night. She was doing good Monday or yesterday, and this morning her fever was a little bit high, but the rest of her vitals were normal. Her temperature was 102.5 this morning, and then tonight when we went to take her and her baby's TPR, her temperature was 104.5. So we let the doctor know on call what was going on. She said to take the temperature twice and then do it again with a different thermometer, and they were still within the same range. The second time we took it, it was 104.2, and then when we got a new thermometer, it said 105.1. So we gave her an alcohol bath to let that kind of start bringing her temperature down, and then they were placing a catheter on her when I headed out. I was going to stay, but there was about 4 people already in the stall and trying to help with that, and I feel like less is more in that kind of a situation. So I just kind of stepped back, and they were going to place a catheter, push a couple of things. I didn't really hear the game plan from Dr. Booth, who's the intern, and I think they were going to do some fluids on her. And then I didn't know this until I was leaving because everyone kind of disappeared, but there is a colic surgery happening. So hopefully that is going well for the pony. And then, yeah, that was my day today. And hopefully I have some cool fun stories for tomorrow. Bye! Okay, here is my summary for Wednesday and Thursday. It's been quite the busy week, so I haven't been able to really take any notes or record like I wanted to. Wednesday and Thursday, I didn't leave the clinic till almost 7-ish, I think, so that put me home at 8:30. So definitely was not feeling the whole recording a video or taking notes or anything like that. I was ready to get home. Wednesday is definitely kind of a blur. I was in hospital most of the day. I was assigned with Dr. Damani, and Dr. Damani and both Dr. Coley, they are kind of the old school cats, so if there's something that they can do by themselves, they're going to do it. So I was assigned to Dr. Damani, and he didn't really have a whole lot on his schedule for that day, so he had a couple of euthanasias out in the field, and so he never really came into the hospital until way later in the day. So he went out and did those by himself, but when he did come back, I did help him with a float and a sheath cleaning, and then somebody was bringing in a sick calf with possible pneumonia, but then we got a phone call that the calf had passed, and the owner wanted us to do a necropsy on him because he's had a couple of calves just kind of die unexpectedly. So with the float, And the sheath cleaning, we use acepromazine along with the sedative, which kind of doctor preference is usually ditomidine or xylazine. And I do believe that Dr. Damani just used Dorm and Ace. And the reason why we'll use Ace in addition with our sedative is because the Ace kind of relaxes the smooth muscle, and so it makes their penis drop, and which makes it easier for the sheath cleaning, because then we don't really have to be pulling and tugging on anything to get them to drop down. They just kind of relax it themselves. And so we'll give them that sedative. We'll always do the float first, because then that kind of gives the acepromazine time to circulate through the system. And by the time we're done with the float, usually by then they will already be dropped. And we did do this in hospital. And so then with the sheath cleaning, they do something called cotton ivory. And what they do is they just fill a bucket with warm water, and they grab a cotton wrap and they tear it apart into kind of handful size pieces, and they put it in the water. And then they have this soap called Ivory that I guess is just really good with breaking down any kind of material. And so they'll put that on the cotton, and that's what they use for the sheath cleanings, and it gets any dead skin off, anything like that. It really helps get all the dried schmegma and beans and everything else out of there. And so that is kind of how everyone does their routine sheath cleanings. And the float went really well for that horse, and I just held. And with the sheath cleanings, basically my job is obviously to hold the horse, but also to watch the horse's body language, because even though they're sedated, they can still reach up and kick at any time if they really don't like what's going on. And so that's my job, is while I'm holding, I'm watching the horse's body language. Is he flicking his tail? Is he shifting his weight to his side to pick up a leg to kind of kick at doctor? Are they pinning their ears back? Are they looking back to see what doctor's doing? So that's my job for a sheath cleaning. And then the rest of the day was just kind of in-hospital treatments and everything like that. On the schedule, they have something called a whiteboard, and it basically shows all the animals that are in the hospital, and it goes hourly. So if there's any creatures that need an hourly treatment every 2 hours, anything like that, it is on there. So every hour, everyone starts checking the computer to see who needs a treatment and what needs to be done. There were a couple of colics in there that we just would check their fluid rate to make sure that it's flowing properly. And then there was also a mama and a baby out in isolation that I wasn't there for when they first brought the baby in. I just kind of went out to do a TPR and check and stuff on them. They were concerned that the baby had Clostridium, and the mother did have melanoma. She had a big lump on her neck. So they were just out in isolation. Poor little baby had severe diarrhea. It was basically just water. He was basically pooping water. And so, and he wasn't really peeing very well for us. So we ultrasounded him and everything, and Dr. Stone wasn't super concerned about his bladder, but she said it wasn't really shaped up the way she would really like it to be. But he did finally urinate for us, and we got a sample, and his urinalysis was great. There was nothing abnormal about it. So she was happy that way. They did send off a fecal on him, but that'll take a couple of days to get back. They might have actually gotten it back today, but I'm not there. Otherwise, they would get it Monday. And then, let's see, what else did we do? Yeah, so that was it, just checking fluids, and then there's also a little Mustang baby that was in there named Willow, and she was in there because of a septic joint. They had done surgery on her Tuesday night, I believe. And they flushed out that joint to try to get any infection out of there. She was definitely doing good. She was thriving the rest of the time she was there. So she needed fed every 2 hours and a couple of TPR checks, I think every 4, just to make sure that she was doing good and make sure her bandage and her catheter and everything were in place. And they have something called Mare Match Mix, is the milk replacer that they use for baby horses. And she liked it really, really warm. So we would make it basically hot to where you wouldn't want to give that to any baby. Let it cool down just a smidge, and she drank it just fine. I did find out, though, that we do not bottle feed foals if we can avoid it, because they can aspirate very easily. So we just make the milk mix, put it in a bowl, and then they can, they'll drink it from there. And she did really well. She had no problems drinking out of a bowl. And then after that, that's when we did the necropsy, and there wasn't any significant signs of anything, especially pneumonia. We definitely ruled out pneumonia because the lungs were perfect and healthy, and there might have been, Dr. Damani kind of had to talk himself to maybe some slight edema in the upper lobes of the lungs, but that could have just been from him passing. But he did see a little bit different discoloration in the small intestine, but the fecal and everything looked normal that we went through. The heart looked healthy and great and everything like that. So and they were kind of scoury, so I can't remember what the owner said that he gave, but he did try to give him a high dose of antibiotics and an injection, and usually he said that really helps clear up anything his calves got, and it didn't. And he just kind of went down, and that was it. He passed. And so what we did is we took samples of the heart, the lungs, liver, intestine, the cecum. We did find some, give me a second, lymph nodes. So we took those as well, and kidneys and everything. So we took all of those, and then we cut samples of them and put them in formaldehyde. And we did send off a fecal for that little guy off to the lab to see if that showed anything. And then we kept the rest of the samples until we got the fecal back, and then kind of seeing if we needed to send in the rest of those samples. And Dr. Damani's big suspicion was enterotoxicity. He said it doesn't really take a whole lot for that to kind of take over a calf. It can hit them, and in a day they can be done, even in a few hours, depending on the age of the calf, their immunity and everything like that. It's pretty harsh on them, I guess. And then after that, it was just doing treatments and everything that day, but it was just like back to back, and we had a full hospital of horses. We had 13 horses in the hospital, so it was pretty crazy. And then yesterday I was assigned with Dr. Lau again, and we were gone all day on ranch calls. We went out towards Red Rock and Rancho Haven, and we were in Southwest Reno, and then we went all the way out to Carson, and it was basically our dental day. Every single place we went to had floats that needed to be done, which is really cool because I'm interested in floats and everything. And it was great because Dr. Lau let me get my practice in. I gave any horse that needed vaccines, I did it. We had a couple of horses that needed Coggins, so I drew blood on them. And then she let me give the sedation for our floats. So she would do her physical, and she would pull up the drugs and everything and make sure that all the doses were correct. And then she let me give it so I could practice hitting my vein, or my jugular vein. And the way she has me do it, and she says it's a great way to learn it, especially if there's a horse that isn't really cooperating. She'll have me throw the needle first and then make sure I'm in, and then place the syringe and either get blood or inject. And that's kind of really helped me. And yesterday I'm excited to report that I hit every time. And so I was doing that all day, and we also had a lot of sheath cleanings and stuff yesterday. So it was a busy day. We had a lot of patients to see, but it was all basically routine stuff. We did a float every time, and she likes to use Dorm for her sedation, but again, we did a lot of sheath cleaning, so we did add acepromazine into that as well. One of the horses we did was a draft mix of some sort, so he was huge, so doing a float on him, my arms were straight in the air trying to hold his head on the headstand, and he wasn't really having it, so I had to hold his head up, which was also a workout, trying to hold a big draft head up in the air like that. And then we got back to the hospital late, and then when we got back, I helped feed Willow for her 6 o'clock treatment, and then just kind of cleaned up the hospital, and I was on my way. They did have a couple of surgeries Wednesday night, but there was a lot of people in the OR, so I didn't really get to jump in and help with anything. It was already a critical case. He was not doing so good as it was. He had been on fluids for a while. He was in his late 20s, and then once I watched for a little bit, and once they got in there, he had a torsion, a displacement, and an impaction. So this poor horse was definitely in a lot of pain, but there was already 8 people in the surgery room, and so I just kind of watched and listened. But yeah, so that was the rest of my week at Comstock. Can't wait to see what next week has in store. Bye!
Oh, my name is Willow, and I like the butt scratches. Oh, man. Excuse you.